This is the second part of the video. I'm going to explain how I approach this clinical case using Sarmen technique, and also I'm going to explain to you probably in details what different type of Sarmen technique probably we can use with Omnicam. So let's start from the beginning. Some of the cases when I have two crowns to prep, and I have 2 milli units in my office. And if I have a busy practice, a busy schedule, what I do, I prep both teeth at the same time. And I'll let my assistant to design the case and the mill and staining later. I'll come back just to bond the crowns. But sometimes we have a case where we have multiple units, and sometimes even with two crowns. You wanna have would like to probably leverage time, milling and preparation. That's why the Sarmen technique came up. And what the Sarmen technique does is we prep one of the teeth, we send to mill, and then while it mills, we prep another one. So again, we have the leverage of the time that's a milling and the preparation, and it's reduced so much time, and especially chair time for the clinician and for the patient. So in this case, we're doing number 19, number 20. And you can see under the crown it's we use a generic copy. We also select which milli-unit we're going to use. But you see in this case I have, as you can see on the screen, I have 2 milli-units, but I'm going to use only one just for educational purpose. So we choose the milli-unit we're going to use, and we select the material. In this case we're going to use EMAX. And we click OK and exit the screen, and we start taking images. We start taking images of biocopy. Before you start prepping the teeth, of course you have to take the preoperative images so you can copy the T-shape if you like the anatomy and shape. So in this case we taking images with Omnicam, and I make sure it's capture all the details between the teeth and from the buccal and from the lingual side, because I'm going to resemble the same anatomy and the same shape of the teeth number 19 and number 20. So you can see that I've been trying to capture as much as I can, but again, don't make a big model because it's going to be hard for the software to process. It's going to take a long time to stitch. So again, when I'm satisfied with the images of the pre-op, then when I prep number 19, you can see the preparation of number 19, number 20 on my first part of the video. And when done with the preparation, I start scanning of my lower jaw catalog of the preparation of number 19. So in this in this model, I would like to capture the preparation of number 20, and I would like to take the image of number 19. So I get the information, because this kind of image is going to help me to stitch with the rest of the models I've been using pre-op. So let me explain to you what can be done in this case, what can be done differently. If I did the pre-op images or biocopy images, I could copy the same image, the same model to my for the lower jaw in this case, and then I can cut the prep tooth with a tool, cutting tool, and remove the tooth from the model. And then when I'm done with preparation, I just try to scan it, prep tooth, and add to the existing model. So once again, let me repeat again. You biocopy original teeth before you start prepping them. Then you copy, not moving, copy the same model to your preparation catalog. Then you cut with a tool, the tools you're working on. And then when you're done with preparation, you scan just that part which you eliminated with the cut tool in this case. Okay, what I'm doing a little bit differently here. So when I'm done with the preparation and I scan the model, so when this scanning is done, then we'll process to make the model. And what's important part is if you want to make sure that if your pre-op is stitched with the preparation catalog, here you will see the green check. So while the model is getting stitched, you wait until it's processed, and when it's processed, you will see the check mark on the box on the buy copy. You see it start adding more data. Wait until it processes, and when the process is done, you will see the check mark here. Then you can proceed to creating the models. You can see the check mark appears here, and you're done. So the next is we start developing the models, and you can see that the software will start developing the models pre-op and post-op. So in this case, when the model is done, I want to make sure that it's stitched correctly. So I use buy a copy catalog right here, and try to check that if the stitch 100%. So I'm not going to go over the details how you marginate the case, but again, it's I use number 2 cord to separate the soft tissue from the tooth structure, and I manually start marginate this case. So when you're done with margination, make sure you don't fall off from the margins, and make sure also if you want to keep this model as your pre-op model for the future cases. So make sure that number 19, the mesial, is you catch all the information, because that's what's going to be most important, because we're not going to have number 20 tooth, but number 19 we're going to create or fabricate this crown. We know exactly where the interproximal contact is, and that's what the beauty of the Sarmen technique, that so you don't have to work on contacts. So when we're done with the margination in this case, we check in our margins, and then we'll proceed with the insertion axis. So insertion axis would be great. It's to make sure it's the mesial is the face to mesial and distal faces to distal, and then you will proceed with the copy line. So in this case, I'm almost done with my margination, and let's proceed with insertion axis. Once again, so make sure that you don't have any yellow shadow. So make sure that the insertion will be correctly, and we are using the copy line. You can see the grayish mark right here. It means you don't have a data. So that's why I put the copy line a little bit above, which is the data that I didn't collect by scanning the teeth. So I'm trying to put the copy line wherever that's possible, where I have a good data. So to catch as possible as much as I can. It's from tooth structure shape, so I don't have to work a lot. So when it's done, it will proceed. And the software will design the crown according to your copy line. When the crown is done, you want to make sure it's that's the crown stitched with your pre-op images or pre-op catalog, and you see this. We can see that by the coloration of the model. And again, when I'm done with the design in this case, you can see that I use shape tool, minus tool, and I develop the grooves on this anatomy, create the anatomy on this tooth. So people that's gonna complain that they don't have a shape tool here, that's this way you can use a form tool, the minus tool, to create your anatomy. So we'll proceed with this case, and what I would like probably to discuss with you also, when you create the model, okay, there's another way to do the Sarmen technique, as Armin explained before. When you create the model, you save the case, you go on top of the screen, you save as, and you move to the desktop, the case you just been working on. So why it's so important? Because the difference between the Bluecam and Omnicam, and the Bluecam, you're going to work on a file which is save as, and Omnicam, you're always going to work on original scan. So the save as is if something happened with the mill or something happened with the crown, you want to probably put more detail, something else, you always have a copy of that the crown on a desktop. But on the original screen, you'll go back to administration, you delete the restoration number 19, so in this case it's going to be number 20, and then you start creating number 19 crown. So I'm going to show you this on the next screen how it works. So in this case I'm checking my crown, so make sure I don't have any binding points, and I use my model box to check if I do have any interference, any binding points, so I can remove before the insertion of the crown. So when it's done, again, what I did in this case, it's a little bit different. I'll open up the new screen. So I'm going to tap open up the new screen, or you can go on the bottom, open up the new cherry site software while you milling the first one. Okay, so your assistant designing the first one. So you open up the second one, and when you open up the screen, in this case I designate number 19 as a by generic copy. Again, I select the material, and it's the same as the first case. I designate as Emax crown, and then I will proceed with the scanning. So while my first crown sent to mill, I will scan the preparation of number 20 and the tooth number 19 in a buy copy folder. So when I'm done with this, I can start prepping the tooth number 19 while number 20 is in the mill chamber. So when I'm done again with the preparation of number 19 again, I will scan, and my number 20 is going to be a stitch tooth between those two models. So once again, it's and this it's very important. So when I scan this, I want to make sure it's number 19. I catch the mesial part of it, so I don't have to work on the interproximal contacts. So when I'm done with the initial scan, I prep the tooth once again, and I'm starting scanning the preparation. So once again, it's my stitching tooth. The most important tooth is number 20. I get a little bit more data just to make sure I have like insurance, so the model will stitch. But again, to make sure it's you're working properly and it stitches, you will see at the bottom right here on the buy copy catalog, you will see the green check, and means your two models are stitched. So once again, it's I check that to make sure it's I collect all the data by scanning, and I'll proceed with creating the models. But again, in this case, you will see again the check mark is done, and let's go to creating the models. So let me refresh again. So in a case how we started. The first case, probably you can prep both teeth at the same time without doing Sarmen technique and then mill at the same time. The second one, that's when you utilizing the Sarmen technique, you prep number 19. Okay, in the you start taking pictures of your pre-op models. Then you copy pre-op models to the preparation folder. Then with the cut tool, you remove the tools you're going to work on. Okay, and then when you're done with preparation, you just add the scanning of that tooth to the existing folder. Then you can work on. The another way is when you create the model, you will save as the case. You put in desktop, and your desktop image, the file is going to be insurance. That's if something happens to the crown while it mill, you have a data, so you can mill again or make some adjustment on the shape, or wherever you want to do any kind of adjustments. but you're working on the existing screen, so you will delete the restoration. Okay, in this case it's going to be number 20, and then you're going to start with number 19. Okay, so I hope it's clear. So in this case, again, it's we marginate this case. I'm not going to go again with all the details how the margination works. Okay, when I'm done, we'll again define the insertion axis. Again, we designated mesial to mesial, distal to distal, and there's a copy line. And you can see that I didn't collect all the data on a mesial. Okay, so sometimes it's crucial, especially you're working on the multiple units, so it's very important so you have the right data on the contact point. That's what the Sarmen technique is for. So again, I copy all the possible, it's all good data on the tooth structure, and then I will create a crown. So when this is done and I'm satisfied with the copy line position, I will proceed and we'll create the crown. So the crown is done. You see I need a little work on it, a little bit the shape tool, and then it will be fine. It's again I'm checking with biocopy, so make sure that I have right contact, the right shape. So I'm going to keep it on, and I'm going to use a little bit form tool to adjust a little bit anatomy on this crown. Again, I use a lot of space bar because it will switch between some of the tools, and it's easy to work. So when I'm done with the shape and it's done here, then I will proceed to mill. And again, I'm going to check with the model box to make sure that I don't bite anything anywhere before I cement. So I hope it clears up some sort of questions people have. Again, just post on the board and I'll gladly answer the question. Thank you.